Welcome to the deep dive. Today, we are looking at something pretty wild. Imagine being a registered counselor like an actual expert, trained to treat mental health, only to find yourself sitting in the patient's chair because the healthcare system just completely broke you down.
Yeah, a total role reversal.
Right. So we are pulling from Dr. Fane Cheng Carr's book, Jom Mindful Gym Now, and we are focusing specifically on the 10-year journey of Lu Su Chi. We really want to look past all that generic wellness advice and get into the actual neurological and systemic realities of burnout.
And her story is just such a perfect example of the environmental gravity of a broken healthcare system.
Yeah.
She spent a decade in government hospitals basically operating as a lone ranger.
Just buried under back-to-back referrals,
Yeah,
right?
exactly. The sheer bureaucratic load was so heavy, she had almost zero time for actual human connection between her sessions.
Which is such a bitter irony. She possessed all the academic tools to treat trauma, but the volume of her caseload made those tools useless for her own survival.
Yeah, she actually developed severe compassion fatigue. She described feeling hollow, like she was just a functional robot.
A functional robot. Why?
Right. And by 2019, the weight became so unbearable that she ended up in psychotherapy herself.
Wait, so a mental health professional got so burned out that she had to go to therapy herself?
She did. And I think it just shows that absolutely nobody is immune to the weight of a demanding system. But that was actually when her psychologist introduced her to the Mindful Gym program.
Which, just to clarify, isn't a physical gym, right?
No, it's a structured cognitive training program. But the crazy part is, before she ever considered using these techniques for her patients, she had to use them as a personal lifeline.
Oh, it's exactly like putting your own oxygen mask on first. You can't pour from an empty cup.
Exactly that. And it wasn't some sudden epiphany either. It was a very slow, rhythmic shift. She started integrating it into just mundane moments, like noticing the sensation of the toothbrush against her teeth.
Brushing your teeth. Okay.
Yeah, or just really tasting her meals, or even intensely feeling her grip on the steering wheel during her commute.
Okay, wait. I have to push back a little here.
Hmm.
How exactly does noticing your steering wheel grip fix severe systemic burnout?
I know it sounds almost too simple, but it really comes down to neurobiology. When you focus intensely on a physical sensation like that, you are forcing your brain's prefrontal cortex to process current sensory data.
So you're forcing yourself into the present.
Right, and that physically interrupts the neural loop of anxiety that's just constantly firing in your amygdala. You aren't just telling yourself to calm down, you are literally hijacking your brain's attention network away from the stressor.
Oh, wow. It's less like generic self-care and more like pulling the emergency brake on a runaway train.
That is a great way to put it. By grounding herself physically, she was forcing her nervous system to decouple from the anxiety of her workload. And that decoupling allowed her to start observing her inner weather.
Inner weather. I really like that term. What was her inner weather showing her?
Well, a lot of harsh self-criticism and really heavy expectations of perfectionism that she had just ignored for years. But once her nervous system wasn't in constant overdrive, self-compassion actually became neurologically possible.
She shifted from a state of doing to a state of being.
Exactly. She found this newfound reservoir of calm amidst all the workplace chaos.
And I'm guessing that internal shift spilled over into her external life too, like with her family.
Oh, absolutely. Especially with motherhood. She calls parenting a relentless mirror for our frustration.
A relentless mirror.
Yeah.
Any parent listening right now is definitely nodding along to that. Kids will just reflect everything right back at you.
They really do. So now, when her daughter does something unexpected, instead of reacting blindly, Suchi pauses. She observes those rising emotions and uses what she calls her wise mind.
Wise mind. So, like the intersection where rational thought and raw emotion meet.
Spot on. She uses that tiny pause to respond with actual intention. And she actually took this practice back to the hospital, too. She runs workshops now to help healthcare workers manage the distress of high workloads.
Okay, but this raises a really tough question for me. Isn't it a bit tragic that we have to teach people to adapt to a broken system rather than just fixing the system itself?
That is such a valid point, and yes, systemic issues absolutely need fixing. Bureaucratic overloads should not be the norm.
Right. Nobody should have to endure that as a baseline.
But learning to navigate inevitable suffering with grace is a necessary survival tool right now. It protects the caregiver's brain today, preventing them from losing their humanity while the bureaucracy slowly catches up.
So you cannot always change the system immediately, but you can change how your nervous system relates to it.
Exactly. The takeaway isn't a quick fix for institutional failure. It's about recognizing that there is always a fraction of a second between a stimulus and our response. Reclaiming that space physically rewires how you experience the daily grind.
It shifts the baseline from just surviving back to actually living. It brings back that spark.
Yeah, it really does.
Which brings us to a final thought for you, the listener. Suji noted that parenting and work are relentless mirrors reflecting our deepest expectations. So, if you were to look into your own daily mirror right now, what is your inner weather showing you? And how might a simple intentional pause change the reflection you see?